In your opinion, what is the most important steps society can take to better support parents today?
I can honestly say, be a part of the village. Be a part of someone's village. Even if you do not have children or you have no experience with the arena of being a parent, or be someone's support system. That it does take a village. My village consists of incredible women, incredible people that are not parents, some that are parents of many, some that are godparents, be that village of support is the biggest thing. That's how you best support.
I love that you say that. And when you use the word village, I think a lot of women, for some reason, just associate a village to their family. And many people I know their family should not be their village. But I don't think that means like you don't have a village. You are powerful and can create a village. Like my neighborhood is my village, and I could not make it without them.
That's right. Your village, I always say this, your village is whoever you make it up to be. It's whatever that looks like for you, and no village is the same.
Well, welcome back, Brittany. Hi, and I'm so excited that we have Crystal Turk here today. I know that we mentioned last week, Crystal is a nurse. She has over 17 years of experience. She currently works as a director of quality improvement, which I'm really excited to ask you what that is in a minute. And I think the biggest thing is I can call Crystal my friend. So I'm really excited that we're able to bring Crystal in and talk about a really big issue that I don't think is discussed enough. And so we're going to talk today about the discrepancies in the medical field when it comes to African American women giving birth, or just in the hospitals in general. And so, yes, thank you so much for coming. Would you mind giving me a second, and introducing yourself?
Yes. Well, I'm Crystal Turk, and thank you for having me. This is a very excited and timely conversation. So I really do appreciate that. The topic that we're discussing today with maternal child health, especially in the area of African American mothers, it can never be discussed enough. There is so much misconceptions out there about the African American experience when it comes to pregnancy, labor and delivery, and postpartum, that there's always room for conversations and even more conversations to come. So it's never talked about enough. So thank you for being a voice and having these discussions, because they're very timely and they're very much needed.
Yeah, absolutely.
It's funny because when you were doing my introduction, when you said 17 years, I cannot believe how long it's been that I've been in the arena of nursing. I love it. It does not feel like work. So I do love my career, and I love the various aspects of my career, but it all comes down to one thing: is patient care, quality, and good patient outcomes. So
can you tell me, what does that look like? What is let's get it proper, director of quality improvement and patient safety? What is that? What does that entail on a daily basis?
First and foremost, no day is the same.
Love that.
No day is the same, which is the biggest aspect about my job that I love the most. It encompasses everything from making sure that our hospitals do not get shut down.
That's important.
Partnering with the state, with CMS, Center for Medicare and Medicaid Services, Joint Commission, making sure our outpatient facilities as well as our hospitals are up to par for walkthroughs when we get commissioned by the state of Michigan to do a walkthrough to make sure that we're providing quality care. It involves tracking quality metrics. And what I mean when I talk about quality metrics, how often is our providers tapping in with those patients that have high blood pressure, that have other comorbidities, such as diabetes, hypertension, and any mental health issues? How well are they touching base with those patients out in the community and providing resources? And my job also dabbles into compliance matters, which is the most interesting part. I feel like when I have to tackle compliance matters, I feel like a private investigator.
Oh, I
I feel like it is like I said, there's no day that is the same. So you never know what you're going to get.
Oh,
it's a wonderful career.
I love that so much. I feel like you could definitely dive into like.
I'm always promoting the profession of nursing because it's so amazing. And like I said, there's so many different avenues in the area of nursing. So once you get tired of one area, you can move on to another area. So I'm like a nurse recruiter. I try to encourage people to become nurses because it's an amazing, very amazing profession.
Awesome.
Yeah, I love that. And I don't know if we actually did introductions earlier, but Brittany is a teacher, and it's
Awesome.
her role is so ever changing. I don't want to speak for her, but I'd love Brittany to just give a brief introduction on what she does, especially in the professional side, and also kind of how it correlates with everything we've been doing.
Yeah, so I'm an instructional coach, and so I run the professional development for the entire district, and I coach teachers in implementation, sometimes compliance, and it's a very like coachy heavy conversation. So through a lot of questioning and metacognition, in which the guru that I listen to in hopes to become one day deals a lot with like, who is behind this person? What is behind this person and the traumas that they've had in their backpack? And coming with that lens helps us see the individual as an individual. And so that allows me to help them coach to be able to grow them as a human and an educator.
Awesome.
Mm-hmm. Yes, she astounds me every day.
That is amazing.
It's honest. It's honest work.
Amazing.
All right. So before we dive into some of the questions that I have, I'd love to, we're talking about our birthing experiences.
Absolutely.
I would love to hear, you have two beautiful children who are now, what is it? 9 and 11? 10. Okay.
Soon to be 11.
Almost.
In November, but 9 and 10, I call them the 19 and 20-year-old. That's how they
That's how they act.
That's how they act.
Yes.
But it's amazing. It's amazing.
They are. They're so sweet. I've had an opportunity to meet them a few times, and they are so kind. I love both of them so much.
Thank you.
You're welcome. But what is your birthing experience? Was it really heavy on the trauma side? Was it, I think the experience of birth is traumatic regardless.
Absolutely.
Especially to the body. But what was your experience?
My experience with both children, as far as being pregnant, my pregnancy experience was very peaceful. I would say it was easy. The pregnancy part, carrying the children, both times. My children are 15 months apart. So I did a back-to-back deal. But with my first pregnancy, I can remember, everything being so new. Unexpected, symptoms of just being pregnant, but nothing that was alarming. Even with the second, the only thing surprising about the second pregnancy was the timing of when it happened and then finding out that I was pregnant. But with the second,
where's your second?
I was pregnant without having a toddler and chasing around the toddler. I'm like, oh, okay, so that's why I felt this way on that day. I'm carrying a child, not even knowing why I'm literally carrying a child around with me. So yes, I would say the trauma of the birthing experience, it all happened during the birthing experience with both children and postpartum as well. So where my experience with trauma and the birthing process comes in, it's along the lines of what happened during those experiences and then after the aftermath, which is something that is not talked about enough especially within the African American community.
Yeah. I actually would say I don't think it happens enough at all with mothers.
With mothers,
and I
no
love
what
that.
The race.
Yeah, I love that we do have a postpartum coach coming in, so we can dive into that too a little bit more. So before you leave today, if you have any questions we can definitely answer them in the next episode too. That would be awesome. Okay. So tell me, what was some of the traumatic experiences that you went through, and how did you navigate that?
Well, with the first childbirth experience with my son, the labor and delivery process, it was in total of 34 hours. It turned into a stalled labor in the middle, and with the help of a fabulous fabulous family member that was very much supportive, we devised a plan in the middle of the labor and delivery to say, hey, you know what, this may not be something that we planned on happening with the stalled delivery, but we're going to pivot. We're going to pivot and look at plan B, which is to try to take it all in, navigate through what you already know, being a healthcare provider, and then just making sure that that birth plan that you did discuss with your OB-GYN, that is carried out, and do not deviate from that. So there were some tough decisions that needed to be made during that first labor and delivery experience. What also came with that was there were some decisions that were out of my control, such as using additional tools to help that birthing process. So there were some decisions that I needed to make, on the fly that I did not plan for, whether or not to use certain medications to make those contractions stronger, to get this labor and delivery moving forward, whether or not I would need to make a decision at the end of the day to have a C-section, just to help make sure that my life is not in danger and my son's life is not in danger. So those decisions that needed to be made during the time of the birthing experiences that were not things that were discussed or part of my birthing plan added another layer of stress while trying to have a baby. So you can imagine when things do not go accordingly to plan, which is something that I would say needs to be discussed more while you're pregnant, with those conversations with your healthcare providers. What do we do now? What do we do next? Preparing for that and helping those patients navigate through that while they're focused enough and in their right mind to make those decisions.
Yeah, so, rather than last
minute.
And I feel like with the women that I've talked to about their birthing experience, whatever your plan B that probably wasn't planned at all is what ends up happening more than your original plan A. And so having that conversation in the right state of mind is crucial.
Yes.
Right.
And actually, so as I sit here, both of you are planners, very organized. And you'd think that in my role, that's how I am, but no, I'm like very spontaneous, have to get things done quick. And so I don't always do the planning. It's not always meticulous. So when I was pregnant, there was no birthing plan for me.
Really?
I didn't come up with one. I remember thinking, whatever happens is going to happen. And that's what's supposed to happen. If for some reason I can't have a vaginal birth, then I'll have a C-section. I'll try to have a vaginal birth.
Right.
The question was, would you want an epidural? Well, if all of a sudden I realize my body can't have it or handle the pain, then I'm going to ask for an epidural. There was no, I'm like, whatever happens.
Awesome. That is awesome. Do you feel that helped you?
I think so.
So,
my experience was, I had an emergency C-section. I was not dilating at all. And so I think throughout that, I had to go into the hospital. I had to be put on Pitocin, get the Foley, do all of those things. And so it was just, I think because I didn't have a plan, there was nothing saying, there was no restriction of, okay, this is the next step.
Right.
Let's move forward. I think the biggest problem for me was that when I knew my body was ready to push, the doctors didn't listen.
Okay. Yes.
And that was my biggest thing. And I needed more, when they did take me in for a C-section, I needed more medicine in my epidural because I could feel them cutting me open.
That was my story with my daughter. That was the biggest, I would say with my son, that the trauma came into making those difficult decisions. But also I felt with the healthcare providers on staff that were in charge, I feel, in my opinion, they were not hearing me. I was not heard at all. And the scary part about that is that here I am, I'm master's degree trained, being in there, I'm on the other side as a patient now. I know how this goes. We try not to, as healthcare providers, throw out that card that I'm a nurse or I'm a provider. you try not to, but there are some certain circumstances in which I faced during that I had to initially,
because it was
I
better
knew
for your health.
it was better for my health. I had more, sad to say, the odds of me living through this and being heard are in my favor when I do make that known that I am a healthcare provider. I'm a nurse. I know what's going on. I've been doing this for many years. And that when I speak and when I tell you what my needs are, and when I'm asking you and I'm telling you what my pain levels are, and when I'm telling you what's working and that's working for me, you should listen because I know what I'm talking about. I do this. So I feel as though with that, in that context, it's sad that you have to make that known in order to get the best care. Because I often think about, even to this day, what happens when that woman is not privy to that kind of information? What if she's not educated, enough about the pregnancy and as well as the birthing experience to be able to know what questions to ask, to know how the process is supposed to go, to ask the right questions? What if she does not have that support system? That part is very concerning. And that's why I feel it's one of the biggest reasons as to why, we're in the state with this maternal health care crisis that we are in. That's just a small tip of the iceberg.
And it's way too small. So I think I mentioned my biggest problem for me was I wasn't dilating. And I was just telling Brittany, the biggest thing my mom always used to tell me is if I'm about to give birth and I feel like I have to push, like I have to poop, then it's time for you to push your baby. Yes. Right. And so that has always stuck with me. And I'm in the bed. I have an epidural. Also, I could only lay on my right side because if I laid on my left, my son's heart rate would...
Yeah.
So I'm laying there and I'm telling the doctors over and over and over again, it's time for me to push. My baby is coming. I mean, this is a conversation for hours and they are still saying no. They wouldn't check me. They didn't believe me. And so I don't even know what's the end result of all of a sudden, could he have died? Could I have died? That's one thing that I never thought about is, what if they continued not to listen to me over and over and over again and they didn't rush me to have an emergency C-section?
Right.
What is that end result?
What is the end result?
And he ended up coming out with a cone head. And poor boy.
To shape the head?
Yeah.
Or mold it like pottery. Pottery babies.
Yes. And, they got a little too close when they when they cut me open for my C-section and he had cuts on his eyelids.
Oh my goodness.
Yeah. So it's so difficult when they don't listen to us. It's our bodies.
Right.
And so I don't understand why they think that they're, because of their education, they don't know what we're feeling. How do we get these mothers to... I don't know if it's because I spoke up and I still wasn't listened to, right? It sounds like you spoke up and until you used I'm a medical professional.
I did.
So what do we do?
I feel a lot of it goes back to the training. I think that there needs to be more training from a lot of the providers when they go through school. No patient is the same. And I think that they are taught that to a certain extent, that no patient is the same. But when we're talking about other health issues and comorbidities, of course, no one has the same identical health concerns or background or whatever is going on within their system. However, when we talk about no patient is the same and being trained on that, you may get a patient that may have some similarities as your patient previously. However, there are cultural differences. There may be language difference. There may be a way that the patient just does not understand what you're educating them on or what they're saying. That's if education is actually happening. So I think there's a time factor in that as well. I've visited several healthcare systems where the ER in the patient education side, it's like a factory. Like you get them in, you give them 5 minutes of patient education, if that, and then you get the next person in the room. What are we doing? That's not going to solve the issue. That's going to turn that patient to what we call a frequent flyer.
Mhm.
They will be back next week or they will come back next month because there was no time from the provider or even the staff members with the state of healthcare that we're in now with all the shortages to be able to educate that patient. And it not only starts it does not start when you get to the ER. It starts in outpatient. When you are a mother and when you are someone that is pregnant, when you're going through that pregnancy, there needs to be a great deal of education, no matter the race, no matter your background, no matter your social economic status, because that plays a big factor as well.
Absolutely.
Having good quality healthcare access and not being treated as an assembly line of a patient, especially when you're pregnant. Every pregnancy is different. Every woman is different. So you need to make sure that you're addressing not only just the patient's physical aspect and their healthcare aspect, but also what we call those social determinants of health. That could be anything from whether or not she has the stress on her back from not having enough money to get to and from her doctor's appointments, whether or not if she has other children, has childcare to be able to come over and have that support system and watch the child so that she can make it to her OB-GYN appointments, whether or not she's working still all the way up to her 8th and 9th month of pregnancy, whether or not she can afford health insurance to be able to come and see you as a provider, tapping into those resources. What is it that the patient needs? That all goes into some of those factors as to why we're in this crisis. Mm-hmm.
Do you think that we have enough resources in the United States for all of those concerns that you just brought up, right?
I, of course, cannot speak for every healthcare system, but when we have healthcare systems that are making millions of dollars in revenue from prescription, medications, from surgeries, from procedures, and you're able to afford the latest and greatest technology to use in your surgery centers or to pay the salaries of most of these, top providers and able to recruit them as well, then I'm sure you have enough to pour into those community resources, especially underserved communities, to help with the education, to help raise awareness, and to help to be able to move that needle when it comes to the disparities that exist.
Mm-hmm.
When we talk about healthcare access centers, health equality, health equity, now we start talking about governmental spending dollars. Where do those dollars go? Are the dollars that are being spent, are they being poured into programs that are needed not only for just the city in general, or those that live in the suburbs or those that live out in rural areas, but also do those dollars trickle down to the inner cities for those people that may have not have the resources available to have a doula, to have a birthing coach, to have nutritional, counseling, or just counseling in general and education provided to help them through that.
Especially now because the 15% increase.
Absolutely.
Healthcare.
Absolutely.
And it's not going down.
And it's not going down.
No.
Yes, it's not going down. So.
All right. Well, let me thank you so much. I know it was kind of an elongated question before questions, but
yes, but I feel like we're flowing through. We're flowing through.
I do. How do you see the intersection of race and maternal health affecting the postpartum outcomes of the Black and African American communities?
I think that intersection is basically touches on what I just pretty much spoke about a little bit before we're discussing. As I think the culture, race, as well as those different social economic, status, as well as your racial background does play a role where healthcare meets whether or not you have access to good quality healthcare. I do feel that it is a conversation worth having, and I don't think that there's a secret to the fact that there are racial as well as social economic barriers that exist for those that are in the African American community, and that's been going on forever. Mm-hmm. It's been many, many years that we have seen systemic racism and cultural biases throughout history. It's an ugly history. But it is something that exists. I don't think that it does any community any justice by being quiet and being silent about it when there are people that are dying because of it. And there are ways that we can move the needle to turn things around, but it takes, I know they say it takes a village, but it takes everyone being on board to make sure that we're moving the needle, and not just for African Americans, but for any other person that of any other ethnic background or social economic status that may not have access and that may not have a voice. I do feel that's where it starts.
I love that so much. Yeah. Thank you. Thank you so much.
You're welcome.
I was also just looking at some of the other questions. I realized we started to get through most of them.
We can still talk.
I love that.
We can talk through them. We can.
Yes. So what do you think? I know we started talking about, education, resources, but how can we, if it was just the three of us, what can we do to really enact change for all mothers, but also the African American mothers who are, maybe not getting the best resources possible? How can we create change, or how can we, what would you advise us to do?
I honestly think that what you both are doing right now is amazing. This is where it starts. Raising voices and having platforms, whether it is through podcasting or social media, or just being out there in the community and partnering with community organizations that heavily focus on maternal child health. And then you can pivot as well and have a focus on maternal and child African American health. But it's all encompassing, right? Because when you're a mom, you're a mom. When you are, when you're pregnant, you're pregnant. So, and I think the education piece as well, finding out through community resources, through national organizations, through policies, through the government, how can you get involved? What is the best route that you can take as an individual? Because we all play a hand, we all play a role in it, in order to see that needle move. Yeah, so you all are doing a great part. You're doing your part. You're doing a very great part by doing this.
Thank you so much.
You're welcome.
Thank you.
I think some people feel overwhelmed.
Yes.
Right? The system is just too big to fix.
Yeah.
Right? And my little person right here can't do enough. So why do anything? So I feel like your comments are exactly what everyone needs to hear. It's just what is the one next step I can do
right now. Yes. And I know it's, there is a African American maternal health week every April. I think earlier this year was, the week of April the 11th. So just things like that out in the community, out within your city, taking part in those programs, taking part in creating action plans with some of these organizations that do help women who are pregnant, the maternal child gap that exists in our communities. Just doing the small thing and playing your part makes a big impact over time. Yes.
Awesome. And, I think the other thing too is whoever wants to create change, we don't have to do it in situations like this, right? I think there's the frontliners who want to create change. And then there's, the back office people who maybe are helping with the paperwork or things of that nature too. So at any point, if there's something that you want to create change for, there are opportunities for everyone, whether it is being out and speaking and, yelling from the front lines, or being so helpful in the back office. Absolutely. So I think that's important for people to know that there are so many different arenas where they can be an advocate or, just be there to help. And that could be just creating flyers.
Absolutely. Absolutely. Or partnering with your local healthcare organizations. If you do know a provider or a physician or a surgeon or a friend of a friend that knows someone, just tapping into those resources as well and asking them and posing those questions. What are you all doing for the, maternal, healthcare sector in that area? What do you all do at your healthcare organization? How do you tackle those issues and make sure there's access to healthcare for all moms and all babies? What are you doing out in the community? Just asking those questions to get people to think that are in those positions to make change. I know right now with the healthcare organization that I work for, within our outpatient departments, we have several providers. I believe there's 5 or 6 OB-GYNs, which is very awesome to hear we're doing this. Beginning January the 1st, these 6 OB-GYNs, they are forming a maternal health support group.
Oh,
so
wow.
they're going to take a subset of their patients that they see that are pregnant. They're going to track them throughout the whole pregnancy, and they're going to provide them community resources as well as additional education throughout those visits. They're going to have focus groups so that the mothers can be heard. And these are for all your minority patients. So I think this
That's beautiful.
this is what we talk about when we talk about making that change with the position that you're in as a provider. And you don't know what that may turn into across the whole healthcare organization, but it has to start somewhere.
I love that. That is so
Yes.
beautiful. And if, once they start it, it could catch on to others too.
Absolutely.
And that is so
Absolutely.
incredible.
And now they're going to begin partnering with 2 insurance plans, 2 top insurance plans to help them fund this. And when we talk about insurance plans, insurance plans, they have all the money.
Yes.
Your insurance carriers that's where the access begins, and coverage begins. And what comes with those insurance plans is education opportunities, mentorships, where you can get, in contact with doulas and partnered up with what the healthcare needs are for that patient. So I think this is a very great collaboration and a very great pilot program that our physicians are starting.
Yeah, I mean, that
It's
is
amazing.
just so beautiful, because really healing, and even through pregnancy, like for me, my pregnancy was rough towards the end. So we've all been through traumas, adverse experiences, and healing happens through community. And so by building those connections, it's not just that we're helping mothers, like we are. And because of that, if moms have a safe place, think about the impact that has on their child. Absolutely. And for the adult that they're going to grow up to be, and continue the change that us mothers have started.
Absolutely. Absolutely.
I'm so
It's
excited.
amazing.
Yes. I'm so excited that that's happening. Okay. Before we get to our final 3, is there anything that you want to tell us about yourself, the medical community, anything like that, before we end with our final 3?
I do want to say, like I said early on, I do enjoy my profession of nursing. I think one of the key things is that we're able to collaborate with the physicians and make a change from within. I feel as though with the knowledge that we have as nurses, we're able to partner, and we do see firsthand changes that need to be made. So therefore, we have the responsibility, like myself, I have a responsibility to be the voice for that patient. And a lot of nurses know this, that our profession is built on advocacy, patient advocacy. We are that person that is there with the patient, listening to their needs. So I feel as though I don't want anyone to walk away from listening to this podcast to think that, oh my gosh, every, healthcare system, they're out to, every physician's, no, we do have some really great providers that are out there, some really spectacular and amazing healthcare systems that are out there. But I feel as though with nurses, we have a responsibility to help that patient find their voice and to be able to use that voice. And you don't even have to be a nurse to do that. Just being a support system and a support person for that individual that's in your life that may be pregnant or that may be having a hard time postpartum, to be a part of their village and be part of that support system, that really helps tremendously.
Yeah, thank you so much. And I'm really, really excited to talk about the postpartum, with our postpartum coach too, because it's such an important topic to discuss. So I think that's why this is probably one of my favorite. I mean, with our 4-part series, it's going to be one of my favorites. So I think it's so important. Thank you so much.
You're welcome.
All right. For our final 3 questions that we will ask all of our guests. What has been the most transformative moment in your journey of healing?
Realizing, I would say, with both children, after having both children, that postpartum phase, realizing how strong and resilient that I am as an individual.
I'm clapping. Yes.
You don't know what you're made of until you go through childbirth. It's different. It when women ask me, or even the younger women in my life and family, what is it like having a child? It's different.
It's different. There's nothing
different. There's nothing that can prepare you for that. There are highs and there are lows, but it will teach you how to tap into a strength that you did not know that you had. So I would say the resilience that I found in myself and the strength that I did not know that I had into that capacity, to be my own advocate, to find my own voice, even with odds stacked up against you, to be able to find that and hold on to that. That was the most transformative.
I love that
part of it.
So good.
My journey. Yeah.
And we are resilient moms.
Yeah.
Very
Absolutely. And I think just to piggyback on what you just said, I don't even think it's just the birthing process, right? I mean, the experience of pregnancy is nothing you can compare it to.
Nothing.
And I mean, it's something that stays with us. I think some people forget what pregnancy feels like, but I still remember being pregnant and feeling him roll around and dance in my tummy, right? I missed that, but I also did not enjoy being pregnant. There, highs and lows. But, I would agree with you. You just, women can endure a lot. Thank you for sharing that.
You're welcome.
What piece of advice would you give the mothers or parents who are struggling with their own trauma or challenges right now?
My biggest piece of advice I would give is to definitely find your inner voice when it comes to prioritizing yourself. Self-care is so big. And I know that we're in the age right now of the whole self-care movement. You got
mental health.
Mental health.
Yes.
It is so important. It's not cliche. Because in that healing process, after any labor and delivery, there is, like we were saying before, there is a certain kind of trauma that comes with that, whether you had a smooth and easy labor and delivery or the most difficult that you ever faced in your life. There is always a certain kind of trauma that comes from that. So it's finding that time for self-care, whether it's through, I know for myself, whether it's through journaling or doing things that you enjoy, things that you've always enjoyed, even prior to the birthing process, even prior to getting pregnant, tapping back into that inner self to say, hey, you know what? I will get through this. And how you talk to yourself, right? How you talk to yourself and being your own coach on the inside, say, I've gotten through it. I will move past this, and giving yourself grace. That's another big one. Give yourself grace and time. You don't have to rush through the healing process at all. No one is holding you to a time frame that, okay, enough is enough. Now let's move past. No, give yourself grace and all the time that you need, and definitely make self-care a priority. So important.
I think we both could, agree with you 100% on that piece.
So important.
It is so incredibly important. Britt, do you have the last question for her?
Yes, please. In your opinion, what is the most important steps society can take to better support parents today?
I would say the best steps, my top 3 is to actively listen. Actively listen. Definitely. Sometimes as parents, and especially mothers, even new moms, sometimes we do not need you to solve the issue.
Can you say that again?
We do not need you to solve the issue. We're not asking you to solve the issue. We need you to actively listen as we process and work through whatever barriers that may exist. So definitely being a support comes along with that. And I can honestly say, be a part of the village. Be a part of someone's village. Even if you do not have children, or you have no experience with the arena of being a parent, be someone's support system, that it does take a village. My village consists of incredible women, incredible people that are not parents, some that are parents of many, some that are godparents, be that village of support is the biggest thing. That's how you best support.
I love that
Yeah.
you say that. And when you use the word village, I think a lot
Yes.
of women, for some reason, just associate a village to their family. And many people I know don't, their family should not be their village. But I don't think that means like you don't have a village. You are powerful and can create a village. Like
That's
my
right.
neighborhood
Yes.
is my village, and I could not make it without them.
That's right. Your village, I always say this, your village is whoever you make it up to be. It's whatever that looks like for you. And no village is the same. Like I know some of my friends have villages that are filled with all their family members. Some villages are filled with all friends that are family, right? Because you don't have to be blood related to be family, right? So some villages are made up of mentors or people that have, I call dropped nuggets of positivity and happiness and support in your life. Those are the people that should make up your village. So I do wholeheartedly agree with that. Yes.
Yeah, I do too. Absolutely. All right. Well, those are our final 3. Any final thoughts from you?
Nothing that I did not, mention prior to. I just thank you so much, both of you wonderful young ladies, for having me
Of course.
on the show, the topic. This is, like I said before, it's a very timely conversation, a conversation that needs to be had and a conversation that needs to continue to be ongoing.
Yeah.
So thank you for that.
You're welcome. And thank you so much. And I have a feeling that this will not be the last time we have this conversation. So it would be great to have you back on our show again in the future.
I would love to.
Yes.
Thank you.
Yes. Awesome. Well, thank you. Next week on Resilient Moms, we have our wonderful postpartum depression coach coming in. And we'll see you next week.